Hey guys, Dr. Stephanie here, and today we're going to talk about if you have trouble straightening or bending your knee, maybe you just don't feel like you can bend it all the way or you can't straighten it out all the way. I'm going to go through 5 exercises that can help you both bend your knee more and straighten it more, because knee mobility is important. If you can't bend your knee all the way, you may have trouble doing things like getting in and out of a car, maybe kneeling down to the floor, getting something out of a low cabinet. And if you have trouble straightening it, usually that can cause some kind of limp as you're walking because you can't get that full extension of your knee. It can also cause pain. If your knee isn't moving throughout its full range of motion, that can create pain, that can cause injuries if you do certain things, if you kind of push through and maybe it doesn't bend all the way, but you just kind of push through things anyway, and it just causes pain and irritation in your knee. And so we're going to go through these 5 exercises that can help, and these are things you can do daily. And you want to, it may be a little bit uncomfortable to do some of them, and that's okay because you're trying to stretch that joint. Sometimes it can be the muscles around the joint, sometimes it can be the joint itself, but whatever the cause, we do want to kind of stretch that joint into flexion here and back into extension. Some people have some hyperextension, where if I straighten out my knee fully, my heel comes off the ground. So that's some hyperextension, and that's normal in a lot of people. So if you compare both sides, maybe one knee can hyperextend, the other knee is a little bit stiffer, then you may need to work on extension on that side. You also should compare both sides of flexion, see how far you can bend. If one knee can bend more than the other, you probably need to work on that one a little bit more. So we're gonna use some different tools. We're gonna work on mobility and hopefully kind of increase that knee range of motion and decrease any pain you have with it. So the first one is pretty simple, and it may seem kind of weird to you at first, but it is, so your kneecap is right here, and if you have your legs straight and totally relaxed, and if you don't have full extension, if your knee doesn't straighten all the way, it may not feel totally relaxed, but relax it as much as you can. So we're going to do some patella mobilization, and that's your kneecap. We're just going to move it. So you want this to be relaxed, and we're going to move our kneecap side to side. So you just feel it in here and just push it side to side. Because if your kneecap is kind of stuck in there, maybe there's some scar tissue or just not moving like it should, then your knee is not going to bend and straighten as it should, because that kneecap should kind of glide up and down as your knee bends and straightens. So we're going to start moving it side to side, and just feel, if you feel any restrictions, feel like it doesn't move freely, because it should move pretty freely. So you're just going to go side to side, just gently. And you want to do that 10 or 15 times. If it feels like it's stiff, this is something you can do multiple times a day. And then we also want to go up and down. So you can kind of take these two, your thumb and your first finger, and just kind of move it up and down. That's really important because that kneecap needs to move up and down as we bend and straighten our knee. So again, 10 or 15 times. If you feel this on both legs, you can do both knees. But yeah, so just side to side and then up and down. This is good to do before you start doing some of the other exercises, just to kind of get that kneecap moving like it should. Okay, then we're gonna go ahead, I'm gonna grab a pillowcase, but you can grab a towel, or if you have like a dog leash or a strap. For this one, we're gonna do a heel slide, and we're gonna do it 2 different ways. The first way, we're gonna hold like this, and my pillowcase is a little short, so if you need a longer rope or strap or towel, definitely use one. So from this position, start with your legs straight, and you're gonna just slide your heel up towards your butt as far as you can. Mine can go pretty far, but if your knee is stiff, you may not be able to go this far. When you get as far as you can, hold for about 3 to 5 seconds, and then let it go back out straight. And then you're gonna pull up again, and then back out straight. And you wanna do this 15 to 20 times. Just pulling as far as you can. And this is where you can feel some discomfort. If you feel like it's really stiff, just hold it for a little bit longer. It's okay to have some discomfort. You don't want a sharp shooting pain, but if it's a little uncomfortable, it should feel like a stretch, especially if your knee is stiff. So 15 to 20 times. You can repeat on the other side if the other knee is also feeling it. So the other way that I'm gonna have you do it, and you can also do that laying down if you want to, is grab a little ball and lie on your back and just place it underneath your heel. And you're just gonna slide your heel up towards your butt. Just kind of roll that ball. And so the ball is just helping you kind of glide up. And you can also do this if you want to place like a towel around your foot while your foot is on the ball, you can do it that way too. So if you do this one, you can do 15 or 20 times. This one and the last one are kind of interchangeable. You can do both if you want to. If your knee's really stiff and you really need to work on it, go ahead and do both. But just kind of roll like that. Get that heel towards your butt as far as you can, and then back out. Okay, for the next one, we are going to grab this block, and you can use a book. You can really use whatever you want to, a pillow. This is going to go under our ankle, so the heel is going to hang off. And you want to make sure you're sitting up straight with this one because we're going to work on knee straightening. So you don't want to be leaning too far back, but you want to relax this leg and just let your knee kind of hang down. So this works on getting your knee straighter. And if you have any pain or tightness in the back of your knee, this is a great one to do. This is the starter position. And for this one, you just want to hold this. And if it's really stiff, you can hold it up to 10 minutes, but you really want to hold it until it's like super uncomfortable and you can't do it anymore, and then relax. You don't want to cause too much discomfort. If this is easy, or when it gets easy, you can add some pressure here with your hands, kind of push down, or I like to grab like a dumbbell or anything heavy. So not super heavy to start, you only want a couple pounds, but you can grab like a bag of brown sugar or something in your house that can just add a couple pounds of weight and place it right above your knee here, and that'll just kind of weigh that knee down. But this will help get your knee into more extension. Now, if your knee can already extend all the way, maybe you have some hyperextension, you don't need to do this, but this is if you feel like you can't straighten your knee all the way, or you feel a lot of tightness in the back of your knee, you can try this one. So start by holding just a minute or two, and then you can gradually increase the time that you hold it, and then add that little weight here as well. Okay, for the next one, we are going to grab our ball again, and you don't need a ball for this one, but I'm just gonna use a ball because I have it. So something under your knee. The ball is nice because it's kind of soft and comfortable, so you could use a pillow too. So for this one, we're gonna do an active movement. So we're just going to lift our foot up towards the ceiling as far as you can. Really kind of try to lock out that knee and then lower it back down. This helps to build some quadriceps muscle strength. It also kind of shows you what it feels like to extend your knee in an active motion. So this one you want to do 20 or 30 times. You can take a break at each 10 if you want to. You're just going to go up and then back down slowly, really trying to get that foot as straight as you can. And then come back down and back down, just like that. And since this one is good for strength, even if you're not having any issues on the other knee, you can do this on the other leg as well. Okay, for the last exercise, you're just going to sit like this, hands behind you, and bend your knees as far as they can go kind of comfortably. You're not pushing it, you're just able to sit in this position comfortably. And if they're way out here, that's totally fine. If one knee it can go up more than the other, you can adjust that one however you want to, but just bring your foot up as far as you can, and then we're gonna actually move our body closer to our feet. So you wanna keep your feet on the ground, and you're just gonna scoot closer and closer as far as you can, and then hold that position 3 to 5 seconds, or a little bit longer if you want to, and then you'll kind of scoot back. And then when you're ready again, you're gonna scoot in, kind of hold that position, and then scoot back out. You wanna do this 10 or 15 times. And I said hold 3 to 5 seconds, but you can actually hold longer. You can hold 10 to even 30 seconds if it's comfortable for you in this position. But all of these exercises will help increase that knee mobility, decrease that stiffness, hopefully decrease any pain you have, and get you back to doing activities that you want to do without limping, without pain, without any sort of discomfort. So try those, and hopefully that helps improve that knee mobility.